everyone. It's a day with your fertility specialist. Yeah, thank God it's Friday. Okay, so today is more like a continuation of what we had on Wednesday. And like I had informed you guys from our last chat last week, Friday, I told you Fridays are for question and answers. And yeah, also for those people that want to share their life experience with Alps hospitals for other people to learn from, it's also a day for you. So you could also drop your testimonies, you could drop your questions, your thoughts on our Facebook platform or on all our social media handles, as well as drop your questions on our WhatsApp number being displayed on the screen, so you could as well have some attention to your questions, your thoughts, your opinion. Like I also said, you could also book for online consultation just in case you feel you're not clear and you want to get further clarification. Yeah, with the online consultation, you'll get a more in-depth explanation to a lot more than we are doing with question and answer. So we'd welcome you for our online consultation. However, it's a day with your fertility specialist. So for those that have dropped their questions, we're here to attend to your questions today. I'm always excited to be your host, Ruth Ogogo. And today with me, I have Dr. Ken Iguda. He was with us on Wednesday and he's with us today again. For someone joining for the first time, it might interest you to know that Dr. Kenneth Iguda is a consultant gynecologist. He's one of the best IVF specialists I've heard of and I've seen. Yeah. He's also a fertility specialist, he's a reproductive biologist, and then a lot more. He's also a minimal access surgeon. Yeah, I must not forget that. So a lot more coming for you from Dr. Ken. But for now, let's go straight to your questions. Once again, share this link with someone, call up someone. I would always say if you have data and you need to share with someone just to benefit from this right now, do that. Enjoy with the show as we get started. Yeah, so Dr. Ken, we have another Q&A for you today. Okay, from our clients. Yeah, we had a lot of questions that came up on Wednesday and we were not even able to exhaust them, and then we still have people dropping their questions. So one of the questions, this person asks, what could make IVF baby die? Or that's more like saying while still in the womb, I guess, at 11 weeks in the womb without bleeding. So what could be responsible for that? And maybe she just goes and maybe she did a scan or something and they're telling her something she's not understanding. So what could be the reason behind that?
Yeah, it's a very interesting observation because that happens a lot, not just with IVF babies. This is just like a first trimester miscarriage.
Yeah.
Then with respect to IVF, if this happens, it may be a chromosomal abnormality.
Oh wow.
Chromosomal abnormalities could be present in an IVF conceived kids or be pregnancies. And chromosomal abnormalities means abnormalities with the gametes, and this could be with the sperms or with the oocytes, the egg.
Okay.
So when this is it's present in the embryos or in the fetus, some of the chromosomal abnormalities may not be compatible with life.
Oh wow.
And trust nature. Nature takes care of itself. So one of the ways is to abort the pregnancy. So that can happen in the form of miscarriage that this individual has asked and all of that. But of course, it's always very painful, not just to the client now, but to everyone. It's painful to the doctor, painful to the client, and all the relations of the client. So chromosomal abnormality is the major reasons why this could happen. Now, this may happen with gametes of older people, or when sperms are abnormal. These days, there are a lot more chromosomal abnormalities with the sperms.
Wow.
Yes, than even with the eggs.
All those men accusing women. Bring your
so there are a
ears
lot
close.
more chromosomal abnormalities with it, and a good number of the chromosomal abnormalities are gender sensitive.
Oh wow.
Especially miscarriages affecting a lot of male fetuses.
Wow.
Yes, there's a lot of problem with the Y chromosomes. So that's one common reason. So the other reasons could be metabolic conditions with the woman.
Oh wow. Okay.
Yes, like undetected or undiagnosed diabetes. When the sugar is high at the point of embryo transfer, for instance, you could have this kind of miscarriages.
Okay.
The baby just demise, the fetus just
Yeah.
demises at the very
Wow.
early stage.
Hmm.
So and that is why uh, or one of the investigations is to make sure you check for the blood sugar level of
Hmm.
not just the woman, the blood sugar level of the
The
man.
man.
The blood sugar level of the man can affect the pregnancy.
Oh wow.
Yes,
Okay.
because it affects the sperms,
Hmm.
so it damages the sperms, and the damaged
Yeah.
sperm can only cause a damaged pregnancy. So
Hmm.
you check the sugar of the man and sugar of the woman.
Woman.
Sugar
Hmm.
anywhere could affect the outcome of pregnancy.
Pregnancy.
Then
Wow.
you have the thyroid abnormalities,
Okay.
you know, either undiagnosed,
Hmm.
misdiagnosed, or poorly treated. If the
Hmm.
thyroid hormones are not normal, they
Wow.
could cause missed abortion or
Okay.
miscarriage, or this
Wow.
kind of demise of a baby or a fetus
Hmm.
in the uterine cavity.
Wow.
Um, Abnormal medications that the woman could be on
Hmm.
could cause it.
Oh
So there are
wow.
just a lot of
Lot.
reasons why
Hmm.
this could happen, and that is why women or couples should have a period of detailed evaluation.
Hmm.
If you go deep into obstetrics, for instance, you have anticardiolipid antibody syndrome,
Okay.
a
Hmm.
condition that has to do with abnormal immune systems
Okay.
related with hypertension and all of that could
Yeah.
cause these abnormalities.
Hmm.
And polycystic ovaries could cause that.
Hmm.
Adenomyosis, for
Oh
instance,
wow.
especially where you have a junctional infiltration,
Hmm.
uterine lining infiltration with adenomyosis could cause such kind of problems, in which case implantation is faulty, and
Wow.
then the pregnancy just cease growing.
Growing.
So
Wow.
there's just a lot of reasons why this could happen. So if anybody has this, it's the responsibility of the medical team taking care of her
Yeah.
to look out for what possibly will be
Be the
causing this,
cause.
because definitely there is a reason why
Reason.
this should happen.
Wow. And sometimes when you tell them they are not seeing the heartbeat of the baby, they're like, "Why I didn't bleed?
Hmm.
Like there was
You
no
don't have
sign."
to bleed. You don't have to
Hmm.
bleed. But at the end of the day, bleeding may just come
Hmm.
after a while.
Yeah.
Mhm.
Okay, so for the person that asked this question, hope we've been able, I know, yes, not just hope, but I know we've been able to satisfy your
There's a
curiosity.
reason. Everything has a reason. In science,
Hmm.
except the reason is not found yet, but there is a reason for that.
So it's good for someone, yeah, just in case you've experienced this, so sorry about that. We hope that your physician, where they're seeing you, are properly evaluated you so that hopefully we don't have this happening again the second time. Okay, so this is another question. How can conditions like PCOS or endometriosis impact fertility?
Hmm.
Mhm.
PCOS is common at these days,
Okay.
and it's going to be very common in future.
Mm.
And the reason is this: um, a diet is better these days, and
Mm.
then it's very modified, and then lifestyle, it's also a little bit different from what the lifestyle used to be
Mm.
before.
Yeah.
And then these are triggers to the to the manifestation of the polycystic disease genes that women could have,
Yeah.
you know. So polycystic ovary makes a woman produce poor quality eggs.
Wow.
Yeah, poor
Mm.
quality eggs. And sometimes it's very technical to treat them in a way that they will produce good eggs, you know. So often they produce too many eggs, and
Hmm.
then the eggs quality may be poor.
Oh,
So when the
wow.
qualities are poor, you only expect a poor outcome in an
Hmm.
IVF treatment cycle. They are actually among the tough classes of patients to
Wow.
treat to get pregnant
Hmm.
when they have polycystic ovary, especially phenotype C and D of
Hmm.
polycystic ovary. The A
Wow.
and B of polycystic ovary are a lot easier. They could get pregnant all by themselves. But C
Hmm.
and D, it's actually a mountain to climb to treat,
Wow.
So that's the problem. And of course, they may have other metabolic conditions
Hmm.
associated with the polycystic ovary, like hypertension,
Hmm.
sugar abnormalities, and
Wow.
these are all the things that could affect pregnancy and outcome of pregnancy. So
Yeah.
it's usually not a very interesting condition. Sorry to say, it's not a straightforward treatment for them,
Hmm.
but then the good news is that they still can get pregnant.
Yeah.
Like for us in ARPS Hospital, for instance, in addition to all evaluations that we have to do,
Hmm.
we take time to check the lining of their wombs to be sure that the lining is okay. The reason is this: they are always exposed to high level of estrogen, and when you have
Hmm.
high level of estrogen, for instance, um, you could grow polyps in the uterine cavity,
Wow.
you know, and then this could affect the outcome of pregnancy.
Pregnancy. Hmm.
Then we go the extra mile. For instance, if the ovaries are large enough to permit for ovarian drilling,
Hmm.
we do that to help improve on their hormonal milieu,
Wow.
and improve on their chances of
Hmm.
having good level of hormones to produce good eggs.
Wow, that's
So
nice.
PCO is just what it is.
Hmm.
But my worries is for young girls
Hmm.
who are still in secondary school,
Wow.
or what you call high school, having excessive weight,
Yeah.
because of
Hmm.
poor dieting and
Yeah.
sedentary lifestyle and
Yeah.
modern lifestyle, and
Hmm.
having abnormalities with their menstruation.
Wow.
The future may not be very nice with
For
respect to
them.
reproduction for them. So I
Yeah.
guess parents need to do a lot to make their
Hmm.
kids eat healthy
Healthy.
and be physically active, so they will avoid a lot of this.
In this part of the world, they feel when you feed them with a lot of junk, you are making them enjoy.
Oh yeah.
Or rather,
Uh-huh.
you're doing more harm than good actually.
Exactly. Like kids used to eat eggs a lot, and parents feel they're doing well by giving their kids eggs.
Hmm.
you know when my kids and I did some studies on eggs, or rather listened to researches on egg, I know that some of the eggs in Africa, in Nigeria for instance, are grown a lot on estrogen diet.
Wow.
you know
Hmm.
and then when you consume this product, you also consume a lot of estrogen. When you have a lot of estrogen, it affects the ovulation,
Wow.
and affects menstruation,
Hmm.
and then affects reproduction at the end of the day. And quietly, I just observed that my kids don't like eating eggs. I never stopped them. They just stop all by
Knowledge.
themselves
Hmm.
because we watch or listen to researches together with them.
Together. Yeah.
So it's good to eat eggs, but in a very limited quantity or frequency. But more importantly, I think the manufacturers of poultry feeds
Hmm.
and fish products should minimize the use of these harmful chemicals in
Hmm.
growing the feeds as being fed to these agricultural products,
Product. Yeah.
so that the health of humans can be improved. We have poor regulatory bodies, and
Bodies.
so
Hmm.
a whole lot of things are pushed into the system, and you consume them at your detriment. So
Yeah.
yeah, that's what PCO does. But the person asks of endometriosis.
Endometriosis. Yeah.
Now, endometriosis is actually when you have a deposit of the lining of the uterus outside the uterus,
Uterus. Hmm.
and occasionally affects the ovaries,
Oh, wow.
affect the fallopian tubes, affect the
Hmm.
support structures of the uterus, and then shows a lot of manifestations.
Yeah.
So it, to an extent, prevents spontaneous conception for some people,
Yeah.
and it blocks the fallopian tubes,
Wow.
and so it makes spontaneous pregnancy difficult.
God.
And
Wow.
then when it affects the ovary, it
Hmm.
makes development of good eggs also very difficult.
God. Oh, wow.
And so you could stimulate a woman to produce eggs, but
Hmm.
then she grows endometriotic
Cyst.
cysts.
Oh, wow.
And
Hmm.
so at the end of the day, they may end up using egg donation. So my
Hmm.
advice actually is, if a woman thinks she has endometriosis or has been diagnosed with endometriosis, for instance,
Yeah.
um, and she's thinking of fertility, and maybe she's not ready to have kids yet, either because she's not married, or she wants to have a postponed childbirth and all of that, she could
Yeah.
consider the option of freezing her eggs, because
Wow.
endometriosis is a progressive disease.
Hmm.
You know, suppression doesn't really help.
Wow.
You know, so you should consider the option of either banking her
My
eggs,
eggs. Hmm.
so that even if the disease progresses, she may have some banked eggs to fall on when she's ready to get pregnant.
Okay. And so someone is asking, can you determine your child's gender through IVF?
Yes, you can,
Okay. Hmm.
depending on the region of the world that you are in.
Okay.
I remember When I was in India,
Okay.
yeah, it's one of the region of the world I've stayed the longest
Wow.
during my early days in medical profession and training, especially training during my minimal access surgery
Wow.
escapades.
Hmm.
You will see in their ultrasound scanning room, even during ultrasound, you don't mention the gender of a baby. If you
Wow.
do that, I think we had a fine of about 75,000 rupees
Wow.
to be paid, and a jail term
Okay.
attached to it. So you don't mention the gender. The reason is this: uh, in such societies where you have a population explosion,
Yeah.
you know, people are very selective of the gender they have because government is putting restrictions. So if it's the gender they don't want, they terminate it.
Oh,
The same thing
wow.
happened in China,
Hmm.
you know, and then you have a lot of females in China who were born and had to be sent on exile,
Oh my.
because of gender matters. No,
Hmm.
but then in some parts of the world like Africa, people choose the gender they want.
Yeah.
But the truth is that even in Europe, people still choose the gender they want, but these practices are not made very open. But in my opinion, people have a right to choose what they want
True.
and go about it the
The
right
right way.
way.
Yeah.
You understand? So yeah, gender can be selected, can be chosen in assisted reproduction technology. And the standard way to choose the gender is doing a pre-implantation genetic diagnosis with sex selection. That way you're sure of which gender you're dealing with. Yeah, I can't tell you the number of requests that come our way weekly basis
Wow.
desiring gender selection.
Hmm.
And there are good reasons. Have 4 girls and you want a male, I don't think there's anything wrong about that. Have
Hmm.
7 girls and you
Wow.
want a male, there's nothing wrong about that, in my
Hmm.
opinion. In as much as I know that there should be a control, but those who come requesting for it have a very genuine
Reason.
reasons. I feel house having both gender is a balanced house, and these kids have a better orientation towards societal growth,
Yes.
integration,
Very true.
and human relationship.
Yeah.
So I think it should be done, and there are a lot
Hmm.
of reasons why people do that, for royal reasons, political reasons, spiritual reasons, economic reasons, and all of that. I once had a client who said, "I want male kids." This
Okay.
was like 4 years ago,
Okay.
and he told me that I don't just want one, I want
Okay.
two.
Okay.
And then I was looking at him. He said, because uh, my wealth is too much and only one male child can't handle it.
Okay.
I said, this is a good reason.
What if the two males are dummies?
You can train them the way you want them to be. And for inheritance reasons.
Yeah,
So
yeah. Hmm.
you always want to have males.
Mm.
But unfortunately, the male gender or the male sex is undergoing attrition, because a lot
Okay.
of attrition happening on the Y arm of the chromosome,
Mm.
deletion of
Wow.
the male characteristics. And
Mm.
so we're still going to have a lot of females being born,
Mm.
less males being born, and probably risking the extinction of the male gender.
Okay.
So please, if people come selecting males, I think for this reason, they should be granted, because it balancing out the world.
So
That's
that
my
three women will
position.
not be dragging one man.
It's already happening.
Okay. Okay, so someone is also
No, but there is
asking.
important reason why you could do a gender selection
Mm.
for medical reasons. There are some
Okay.
disease conditions, that affect some sex, and then
Mm.
you want to avoid them by selecting the sex it doesn't affect if you have a gene for those abnormalities. So
Mm.
for health reasons, you could do gender
Gender
selection.
selection. Okay, so let it not look like it's only the male. You could also do selection to get
But
a
but
girl.
incidentally, my
Yeah.
observation again is females actually come more for male gender selection, the women,
Yeah.
as against the men.
Wow.
Yes. But they do that in fear. You
Yeah.
understand? So they are doing it not just for themselves, they are doing it just ahead of the man. But the man actually
Yes.
wants it more than the women. Men are always shy.
Well, if you have 4 boys, you could still do sex selection to have a
No, people
girl.
do sex selection for girls.
Yeah.
Yeah. Just up to last week. Yeah. No, was it last week? This week,
Okay.
I did an embryo transfer for somebody who wants gender selection for a female.
Wow.
Yes, I did an
Okay.
embryo transfer for that.
Wow.
So people still do. So it's all just that it's more common with the male's gender
Yeah,
than the
than the
female.
female. Mm. So it depends on what you want. Just know you could actually have gender selection done. Okay. So we also have viewers, keep your questions coming up. Keep your questions coming up. And then yes, if you're getting answers to your questions, let me see your like buttons. Hit your like buttons and let's see your likes coming up. Okay, so I also have another question. Someone is asking, how many times can someone try IVF?
Wow, interesting. Um, you know, people have different tolerance,
Okay.
you know, and different endurance,
Hmm.
and they try IVF just once and probably don't succeed, and their whole world come crashing,
Yeah.
you know, and I see that's where the world ends. So, from research perspective, your chances of getting pregnant with IVF increase by the time you have done up to 6 cycles of IVF.
Wow.
So the more IVF cycles or treatment you undergo, the
Wow.
more your chances of even succeeding at
Hmm.
one.
Hmm.
So meaning that um, people are likely going to need more than one IVF cycle to
Hmm.
succeed.
Wow.
But a good number of people succeed once.
Yeah.
More numbers succeed after the second attempt,
Hmm.
and more number will succeed by the time they're doing the 6th attempt.
Wow. Wow.
Saying all of this, I've seen a woman who have done IVF 21 good times.
Kidding me?
Yes, 21 good times.
Wow.
Yes, and this was for me in 2008. 2008, she had done up to 21 counts. In the 21
What?
attempts, she had gotten pregnant 3 times.
Hmm.
One of the pregnancy was an ectopic
Oh
pregnancy,
my.
so she ended up having a surgery to take care of that. The second was a missed abortion.
Oh
Then the
no.
third, she delivered twin boys.
Wow.
And that was the last count I had before I relocated from my first place of practice.
Wow.
So that's 21.
Hmm.
So for me, so long as you've not gotten what you want and you have the guts and the means, just keep trying. But make sure that they understand what's really wrong with you, and so you're
Hmm.
not just trying in vain. So I
Yeah.
have seen that, then I've seen 11, I've seen 8,
Wow.
and all that number. So
Wow.
21 was my highest count, but then this was 19 sorry, 21 put together, Nigeria, United Arab Emirates, and India.
Wow.
So
Wow.
with my center, then she succeeded 3 times.
Wow.
Yeah.
Wow. Wow.
So if you're discouraged
I'm
at
short of
one,
words. 21
if
IVFs.
you're discouraged at one, what would you say about this lady?
Yeah, like
And
she
then you
really
know
has
what?
courage.
I admired her
Her resilience.
her resilience. You know, her countenance throughout. She was always having beautiful
Wow.
outlook. I know she probably would have had a time where she broke down, maybe cry
Yeah.
at home, had a fight
Mm.
with her partner, and
Oh
had all
wow.
kinds of discouragement. But
Yeah.
man, for doing it 21 times,
Honestly.
that was a world record. Yes, and
Wow.
I'm not kidding. This 21 times she did
Wow.
it.
Wow.
You understand? So she was just doing it anyhow. Just
Whichever way,
anyhow.
a result has to come
Oh
from
yeah.
it.
And it's easy to do a natural cycle IVF
Hmm.
21 times, because the side effect is not much.
Mm.
It's not very invasive. You could
Hmm.
do it practically every month. But then she wasn't doing a natural cycle IVF. She was doing a
Hmm.
conventional
Oh my. Lots
IVF.
of injections and all.
Yes.
Wow.
She had a very bright outlook to life,
Wow.
and she was always happy.
So for someone out there
I
that
guess her
has
religion contributed though.
okay.
Yeah, because there are some religions that teaches you that it's the will of God, even
Mm.
when things go bad.
Oh
So
yeah.
even though it is not, I don't believe it is the will of God, because God doesn't wish somebody to fail 21 times.
Oh yeah, some people if they just hit one, they'll be like,
I
okay,
see
if
that's
it's
how God wants it. No, man. And just the same way people were born with diseases and say God made them that way. People are born short and they say God made them short. God doesn't make short people.
Dr. Ken, you have come again.
No, but that's true. God doesn't have time making short, tall, or fat, big people. No,
Mm.
no, no, no. The simple reason is this: people are made by their parents.
Mm.
That's true. So don't give because you don't understand what genes all about. You
Mm.
don't understand what human responsibility is all about. People blame God out of ignorance and religious sentiment, and because
Mm.
they are being brainwashed and indoctrinated, they accuse God for every wicked thing. You're born with sickle
Wow.
cell and you say it's God.
Mm.
Was it God who made you choose? What
Yes,
gave
yes,
you the
what
sickle
now?
cell thing?
Mm.
It's just definitely not God. So you see, my son looks like me. It wasn't God that made him look like me. you know so God has more important things, I think, to do. you know if I didn't marry my wife, for instance, and I get married to someone else, which was also very possible, my son will have looked different. So it is a product of the gene pool that come together in a relationship, and is a responsibility of the guy and the lady that brings about what happens to a child. It's just not God. So they should leave God out of it. So, but because they have this feeling that everything comes from God, whether good or bad. I'm a Christian, for
God breathes
instance.
life into the child.
That's accepted. I'm a Christian, and we're taught,
Yeah.
and I believed
Mm.
that every good thing comes from God,
Yeah.
and no
That's
bad
true.
thing comes from Him. God doesn't choose for us who we become friends with. We
Mm.
choose for ourselves, and
Yeah,
then
that's true.
whatever decisions you make, there's always a consequence. So the
Yeah.
products are not the handwork of God. It's handwork of our choices. That's what I think.
Genetic accident.
Yes, it's all about genetic lottery.
Mm.
It's all about genetic lottery. You know, it's just lottery. Let's not go that way. Sorry about
Okay,
that
yeah.
talk.
Okay. So yeah, keep your questions coming. So we have a question for you also. That okay. This person is asking, is it advisable for someone who did IVF to take pineapple? And this that's not all. The same person is asking if someone did IVF, is she supposed to be in one place or she can move around?
Yeah, for pineapple, for instance, no, it's not
Okay.
advisable.
Okay.
I never used to believe it until they showed me the document. There's a
Oh wow.
chemical in pineapple, for instance, that
Okay.
affects implantation.
Oh
Yes, and
wow.
I'm told not just pineapple, there are other fruits associated with that. So now I don't know so much about fruits. So if you read anywhere that pineapple should be avoided or oranges should be avoided, just look for the reasons. And for me, all the period of waiting to get pregnant, you could do without any of the fruits. Just
Mm.
go for the healthy ones. It doesn't hurt you. You
Mm.
can just tell me that you're fasting to
Mm.
get pregnant.
Yeah.
And so, yes, pineapple, for that I know. I've
Okay.
forgotten the name of the chemical. I guess one day I'll remember.
Okay.
And I will talk about it.
Okay.
So, yes. What's the other part of the question?
Can the person is after the person has had an IVF, can she move about or she should stay one place? That's
Oh
okay. I know you're imagining a lot of
okay, let me tell you. There was a day some clients, just finished an IVF treatment cycle.
Mm.
Then usually some will tell their husbands that the doctor say they should go sleep in a hotel where they do just climb upstairs. They don't come down. They don't even bath. They don't drop cream. They're
Oh
just
my
lying in bed.
goodness.
And you know how
Wow.
they lay in bed?
Mm.
Like cops. They just lay this way
Wow.
because they are also told not to lay on their stomach,
Oh my goodness.
that the baby
Wow.
will be choked.
Oh,
And by the way, the uterus is not even in the stomach at that point in time. It's behind the pubic bone.
yeah.
Nothing gets to it at that
Wow.
point.
Wow.
And so they lay this way. And then this call came. I have waist pain. And usually we don't like hearing waist pain. If you have
Yeah.
waist pain, it probably means that the uterus is cramping.
Yeah.
I say, and I thought, I says, hey, though I can't see you, I assume you're lying in bed. Yes, doctor.
Mhm.
And I assume you're facing upwards. Yes,
Yes.
doctor. And I assume you've been there for quite a number of days. Yes, doctor. Okay, that's why you're having back pain.
Mm.
So,
Oh my.
instruction after IVF is live your normal life.
Mm.
Live your normal life.
Mm.
That's all. In fact, the more you live your normal life, the more you have less anxiety. It's
Mm.
when you sit put, then you think so much, and the anxiety can be stressful,
Mm.
and then can even cause the pregnancy at
That's
some
so true.
point. So
Mm.
just live your normal life and just be healthy. just normal life, but maybe don't do something too stressful. Like in Africa, a lot of stressful things, going to the farm to fetch firewood and all of that. Just live normal life. That's the only the only instruction.
So
But
please don't stay
don't
well.
fight.
Don't quarrel.
Oh yeah, I used to tell them, don't. For me, it's more important not to have a quarrel, not to have a fight, because you see, success with IVF has been associated with a peaceful and a happy mood.
Wow.
Yes, just like when the gospel or the scripture says a merry heart does good like medicine. That's one good example. So now there are researches that shows people that listen to music and just feel happy about themselves and have good moods achieve more success than those who are on the opposite side.
So that's a take home for this person.
So don't fight. Even if your husband offends you,
put something in your mouth.
Yes, don't fight. Don't fight, because they fight so well at that point in time. So don't fight. I also tell them not to forgive. Because forgiveness is not good too. Sometimes you only feel good when you revenge. You understand? But don't revenge immediately. And I'm very serious. You know, that is, you don't revenge immediately, so you don't feel cheated. You can revenge later when it's right, and I'll tell you when to revenge. But I'm serious anyway. I'm very serious.
Okay.
You understand? Because when you revenge, you feel peaceful.
Jesus. Okay. So hope this answers your question. Yes, I know your question has been answered. So we have another question.
But the bottom line is just live your normal life, but avoid trouble. Stay away from trouble.
Yeah. So what are the supplements for? What are the supplements for PCOS?
There are several of them.
Okay.
And I think the guiding physician should give you the advice on what to do. Usually you see the selenium, the manganese, the vitamin D3, the myoinositol, folic acid, together with metformin is also fine.
Okay.
These are all things that should be given to you by your physician, okay, and it helps in improving the outcome of treatment and outcome of pregnancy for those that have PCO. So quite a number of supplements.
So you don't just stay and do your self-medication. Make sure you see a good physician, so they're able to guide you on the one that's appropriate for you. So next question: what is the major cause of IVF failure? I thought we talked about this. This person is asking. Maybe you should watch on Wednesday's video, but maybe you could say something. Dr. Ken, what's the major cause of IVF failure?
Age. When the husband is too old, it could fail because of chromosomal abnormality.
Yeah.
When the wife is too old or the source of the eggs is old, genetic abnormality could be present. So the main cause, actually, the common cause is genetic abnormalities or chromosomal abnormalities with the gametes, whether the sperms or the eggs. Secondly, sperm abnormality could cause the failure. Then the nature of the uterine cavity, the endometrium, if it's not healthy, failure could happen. If there is hormone abnormality, even at the point of egg collection, embryo transfer, failures could happen.
So you could also check our other video. I think he also talked a lot about why IVF could fail in our last Wednesday chat. That's just 2 days ago. So you could always check that and you would get full details. Okay, so this person is asking, what's the fate of a patient with frozen pelvic and high prolactin level during IVF?
The fate?
Yes.
Just to try whatever needs to be tried. I think the physician should guide this individual, but then when pelvis is frozen, you can only extrapolate. Sometimes it may be difficult to get an egg from frozen pelvics because it may not allow for good ovarian response. But sometimes there could be eggs and then you could retrieve them, and sometimes it may be difficult to retrieve. But then bottom line is, if eggs could be gotten and there are good enough sperms, she could have a good pregnancy.
And then high prolactin level during IVF
should be corrected. Well, of course, the level of prolactin during IVF, sometimes you may want to even do an MRI or a CT scan to see if there is a growth in the brain, pituitary gland, for instance, adenomas, causing secretion of prolactin. And sometimes you may even have to address that before IVF.
Okay.
Otherwise, it may be a pointer to a major health condition that pregnancy can complicate. So you need to deal with that. But often, it's a polycystic ovary that may cause high prolactin, because prolactin is often high for women with polycystic ovary disease. So when prolactin is high, you should also take a look at the luteinizing hormone and the follicle stimulating hormone, and they usually may be abnormal, and the anti-Mullerian hormone may be high. This is pointer to polycystic ovary. So you need to have a good diagnosis for this individual before going on with the treatment.
Okay, so hope that answers your question. So you have someone asking, what would you advise when one of the partners does not want a donor? Maybe the partner does not want donor egg, or vice versa, donor sperm.
They should dialogue.
Okay.
They should dialogue. Because what options then do they have? Because if one partner doesn't want something and that's the way to go, then it means that they are at a stalemate. And the treatment may not continue, except of course you want to do the IVF anyhow, and I mean anyhow, and get away with it at the detriment of your own relationship. Yeah. So I know sometimes it requires convincing, and sometimes it's difficult for the partner to convince the other person on the modality of donation. But if they sit with the physician, for instance, you may be able to see reasons why donations may be important. And by the way, donation in this part of the world is very high, very frequent, and the reality is it's going to be more frequent in the near future, because so long as women don't get married early and have kids early, and men continue in this lifestyle of gadgets and stress and abnormal life, the gametes are going to be getting poorer and low, and then donation is going to be in high need. And so that's the reality, and people need to be ready for that.
Okay, so this is me thinking, Dr. Ken is a physician, so maybe he's trying to also for some ethical reasons. But then this is me thinking, if you're an adult, yes, I think you can make your decisions yourself. And you have a partner though, but sometimes I think there are decisions sometimes that as an individual, as an adult, you could take on your own. Depends on whatever you might have actually calculated a lot of things, and you could decide. And then no physician will tell you, because you are taking this decision, I won't treat it because your partner is not accepting. It's your decision. You take responsibility for it, and you could do it if you want it. So this is also in your hand. Your physician will not choose for you, okay, I will do this for you. It's up to you, the individual, to decide if this is what you want. And if this is what you want, go for it. And then you bear whatever comes with it afterwards.
Yeah, you see, sometimes I see ladies that obviously have no eggs. And then I tell them, from your laboratory investigations, and your age, it's evidence you don't have eggs, or you don't have good eggs. You may be needing egg donation. And then she goes, no, I have eggs.
Okay.
And I want to use my eggs. You don't know what to tell them at that point. And then you may have talked why your age is not a good age for eggs production. And she still wants to go with her own eggs. So sometimes I think women need to understand their biology. That these eggs are not inexhaustible, and they are not there forever. They are timed, and they are clocking out, and they're getting exhausted. So that's why I call nature as the biggest cause of wastage. A man meets with a woman, produces 1 million sperm, and only one sperm does the work. And the woman is born with close to 700,000 eggs. She is going to have 4 babies. What happened to all of that? Nature wastes them. And your decision also contribute to the nature wasting them. So it's good for women to understand that you reach certain age, you don't have eggs.
And yes, Dr. Ken is talking to the women. I'm talking to the men. Yes, men, you are open to say your wife should take egg donation. When they say, oh, yeah, the man takes sperm donation now, it's also always hard. So I think both parties, you should be open to it once they give you the counsel, and just
but I think I agree with you. There was a day a guy was meant to take sperm donation. you know. And that was when I realized that it's very difficult for both parties
Yeah.
to accept this decision. It's a
Yeah.
tough decision to make.
Mm.
Is it, Dr. Ken, do you know what it means to take sperm donation? I was like, okay, let me assume I'm the patient here.
Mm.
I decided to listen. I can be stubborn sometimes. So this time I decided to learn something from the patient perspective.
Yes.
He said, do you know what it means when I wake up in the morning and see a child walk past me
Oh wow.
and realize that it wasn't my sperm?
Mm-hmm. Wow.
And then it got to me again. I was like, yeah,
Mm.
there's some sense here. He said, Dr. Ken, it's not
Yes.
easy. I
It's
was like,
not
man,
true.
I agree it's not easy. So this is what the women go through all the time.
Yeah.
And then because they are women, they just accept it
Mm.
without thinking. So who knows? They probably will cry several times
Yes,
over and
exactly.
over at night when nobody is seeing them because they are taking egg. But you know the beauty is this: when you accept egg donation and you get pregnant, there
Yes.
is the
Some form of
owning.
bond
There's
and
the owning
connection.
of the baby by you because there's a transfer
Yes.
of genetic materials from you to the baby. But not
Yes.
so with the man anyway, because
Yes,
he doesn't
exactly.
get
So it's
pregnant.
easier for the
So it's
woman
easier for the woman
than the
than
man.
for the man. You
Yeah.
know, so when he talked to me that way, I now realize that there is some toughness in this business, you know.
Yeah.
So sperm donation is not easy,
It's
egg
not
donation is
easy.
not easy, but you know, as couples, you should always work as one, and
Mm.
it shouldn't be a blaming game,
Yeah.
and it shouldn't be a game of who is weak and who is strong. You
Yeah.
should support yourself to make this decision because
Mm.
people still adopt kids.
Yeah.
So if you could
Mm.
adopt kids, why not take a decision to bear a pregnancy that will be born
Yeah.
in your home?
Yes,
You know, for
true,
me, that's
true.
superior.
And it's just
You
you
know,
that knows.
yes,
Nobody
who
knows
knows
really.
exactly, except you go
Mm.
telling.
Yeah.
You know,
So that's for that question. So someone is asking, can someone conceive with ovarian cyst?
or a lot of times, women have cysts all the time, so they
Yeah.
conceive almost all the time with ovarian
Mm.
cysts. But then it depends on the kind of cysts. If you are privileged to be seen by a doctor who knows you have the kind of cysts and monitors you and sees that the cyst is a dangerous cyst, it should be taken out before conception. But a lot of the cysts are functional cysts.
Mm.
And so you could get pregnant with those kind of cysts. But then the decision should come when you are evaluated by the gynecologist, you know.
Okay.
Mm.
So we have someone asking, what do you think about intramural fibroids type 3? Okay. So now I'm wondering, for this person that's asking this question on fertility, could it be a minimally invasive treatment like a microwave or radio frequency a possible solution? Okay, so that's the question this person is asking. I don't know if you understood what I just read.
Yes, I understand it.
Okay.
Yeah,
So
I
that's what the
understand it.
person is asking. What do you think about intramural fibroids type 3 and fertility? Could it be a minimally invasive treatment like microwave or radiofrequency a possible solution?
So, the current stand amongst those of us who are intrauterine surgeon,
Okay.
this position was arrived at uh, um, 2 years ago
Okay.
in Spain,
Mm,
where experts in intrauterine surgery
yes.
feel that so long as you have a fibroid before fertility care, it should be taken out.
Oh, wow.
Before now, that wasn't the decision.
Mm,
The regular gynecologist will watch until the fibroid is complicating something
yeah.
before they advise you. You know, so I'm an intrauterine surgeon. You know, and we feel it should be removed because given time, the fibroid is going to grow and may cause one problem or
Or
the
the
other.
other.
So, but the modality of removing this kind of fibroid can be removed by minimally invasive technique, you know. And then the minimally invasive technique now varies, could be laparoscopic, you know, it could be the microwave,
Mm,
you know, because that's actually the reigning aspect of minimal invasive surgery. Now,
okay.
microwave
Wow.
ablation of fibroids.
Wow.
But then in China, for instance, and in South Korea,
Mm,
there is a protocol for microwave ablation of fibroids,
okay.
you know. And incidentally, I'm working with those organization,
Oh,
you
wow.
know, for microwave treatment of fibroids. Then the HIFU can be done. Open surgery can be done. It depends on the expertise available wherever this individual lives.
Lives.
But
Okay.
yes, it's okay to take care of it. But of course, some traditional gynecologists can decide to go ahead to treat you even without removal. But it depends on the size. She didn't mention the size.
Yeah, she didn't.
If the size is not big enough, could be left, could be, you could have your treatment with it. But the thing with fibroid is this: no matter how small it is, it affects the contractility of the endometrium. And when embryo transfer is done, this may make the abnormal contractility affect negatively the outcome of the pregnancy. But yet you can get pregnant with a degree of intramural fibroid.
So hope that answers your question. If you feel you're not satisfied, you could book an online consultation and Dr. Ken will give you all the details that you need. Or
and laser can be used on this at the same time. You know, if you use a laser, for instance, a laser with a radial fiber, and you just, like an injection, you just poke it through the attachment of the fibroid without cutting this fibroid, depending on the size of the fibroid, okay, it could shrink the fibroid and devitalize the fibroid, and you could go ahead to have your treatment with it. So all options are just available. And with us, the laser procedures feasible, and the minimal invasive procedure is feasible, and all of that.
So you're right. Yeah, the right platform right now, so you could get the help you need.
That's true.
So I'll take a last question, and then would call it a day for today's question and answer. So this person is asking, can tube flush be of help for a PCOS patient?
What?
Tube flush. So,
well, I don't know what tuber flushing is. I don't know what it is. So to be very candid with you, I don't know what it is, because I see tuber. I heard about tuber flushing. What are you flushing in the tube, actually?
And then relating to PCOS again.
Relating it to PCOS also makes it difficult for me to understand. Yes, so I want to assume that what that means is that when your tubes seems to be blocked, you go to do a flushing of the tube. You know, it depends on what's causing the blockage of the tube. If the tube is mechanically blocked, tuber flushing is just a waste of time. If that is what this person is asking about, you know, it may just be a waste of time. But you need to understand what's making the tube blocked. Then you treat it in the best way that needs to be treated.
Okay, so that'll be all. Thank you so much, dear viewers, for engaging us with your questions. Yes, they are duly noted and appreciated. Thank you once again for staying glued to your screen. Thank you, Dr. Ken. It was nice.
Yes, I like treating religious people.
Okay.
Because you hear all kinds of religious thoughts about fertility. You know, and then most times, when I get back home and trying to play over how my day goes or went, I think about what gave them the thought process and that understanding, you know, what they do. To the extent that we do, you know, and it's good to keep some religious sentiments, because the religious sentiment that people have about procreation, reproduction, conception, and modalities of conception is doing more harm to them than nature. You understand? So they should seek to understand what reproduction is and give it the attention that it deserves. And my advice actually is to the religious leaders, you know, when the technology is out, you know, for the benefit of mankind, don't dissuade your followers from accessing it. You should seek to understand it. Understand it and what it represents, and be a real leader by teaching your people the truth. As a leader, you have a responsibility to understand the world a step ahead of your followers.
Please call your pastor right now if he's not connected.
Yes. So you be a step ahead of all your followers, so you can be a good guide and a good counselor, because as a leader, you're supposed to be a financier to your follower, you're supposed to be the guide to your followers, you're supposed to be the tech guide to your followers, you're supposed to be the counselor to your followers. So you need to understand, because some people have said that that IVF babies do not have soul.
Oh wow.
Oh yes, IVF babies do not have soul. I was like, okay, who then have soul?
Oh my goodness.
Oh yeah, see, they don't have soul, you know.
And the funny thing is, some of these pastors actually secretly access this service, and then they want it hidden from members, and then you wonder, why are they hiding it from members? You don't want them to see the light, and you already know what is involved. So please, if we have a religious leader watching right now, yes, we are also we're also letting you know that it's if you have this knowledge, God is still the center of this all. So it's not a bad thing if you are recommending whatever fertility care it is that you feel your member might need. Because I know a couple of pastors too that refer their members to maybe try seek help. If it's IVF, go for it. And but there are also a couple of pastors and religious leaders that just feel if God does not do it, let them remain like that. But I mean, just keep it open and help your members to have a reborn of their mind, a mind rebirth, so they're able to be open and accept technology as it comes, while you hope for the best of outcome. It's been amazing having you viewers.
Now
Sorry,
you're talking like a pastor, right?
so we have to turn the table around. Okay. We
Oh
have to
yeah.
shake the tables a bit for the for the religious
Because
leaders,
we
and
see
not
God.
just the
No, no, no.
pastors,
You know
the
what?
imams and all
We
of them.
see God in the laboratory. You
Yeah.
understand? We see God in the laboratory.
Yeah.
Because I was talking with my son the other day, and we're arguing with my daughter. She is doing a course in biotechnology as a child,
Wow.
and then he goes saying that, Ken, Daddy, do you know that from the account of the Bible, God brought out a woman from the ribs of a man? That maybe God is giving us a hint that in the future, reproduction is going to be a sexual reproduction. I looked at him and said, hey, how old are you talking about all this stuff? I don't know he understands all of those things. You see, so yeah, we should think out of the box. A man doesn't have to sleep with a woman to make her pregnant. Yeah, and a man doesn't have to be around for his wife to be pregnant.
Oh yeah. Yeah, so that'll be all for now.
Just leave the job for us.
So dear viewers, that'll be all for today. It's been amazing having you all. Yes, and I know and I know you had a good time with us here at Alps Hospitals. Continue to like, continue to share. Yes, keep your questions coming. We'll definitely attend to them properly. Once again, thank you for joining and have a good evening. Bye.